Yeah, guys, welcome to this episode with, of course, our own Dr. Adler. Today, we're talking about something super important. Something that could quietly mess up your medications without you even knowing it. We're talking about common foods, yes, regular stuff you eat or drink every day, that can block or change how your medicine works. And trust me, what you're about to hear could change how you think about your daily habits.
Thanks for having me back. Look, most people don't realize this, but even the healthiest diet can become dangerous if it's not matched with your medication. You could be doing everything right, taking your pills, eating your veggies, and still not getting better. And the number one food that fools the most people, it's something you probably had this morning.
All right, document. Let's dive in. You mentioned that the number one sneaky food is something in our morning cup?
That's right, it's caffeine, found in coffee, tea, energy drinks, sodas, even chocolate. Millions of people take medications in the morning, then wash them down with a hot coffee, and they have no idea they just made their meds less effective.
Wait, are you saying my coffee is fighting with my medicine?
Exactly. Let's break it down. Caffeine isn't just a pick-me-up, it's a stimulant. That means it raises your heart rate and blood pressure. And when that happens, certain medications can either work too well or not at all.
So what kind of meds are we talking about here? Like painkillers?
Worse. We're talking about serious medications, things like ADHD drugs, Adderall, Ritalin, those types. These are already stimulants. Add caffeine on top and now your heart's racing, your hands are shaking, and you feel anxious or even nauseous. It can even trigger a panic attack in some people.
Wow. So, someone with ADHD could actually feel worse if they drink coffee with their meds?
Absolutely. And it doesn't stop there. People with high blood pressure, caffeine raises pressure even when you're on meds. That means your pills work harder, your heart works harder, and you increase your risk of stroke or heart attack, especially if your pressure isn't well controlled.
Okay, that's scary. And I'm guessing a lot of people with high blood pressure are older adults.
Correct. Older folks are especially at risk. Their bodies process caffeine more slowly, and if they're on heart meds like propranolol or verapamil, the caffeine can reduce how effective those drugs are. It changes the way the body absorbs them. That means even if you take your pills on time, they may not be doing their job.
Hold on. Let's say someone's taking their heart meds at 8 a.m. and sipping coffee right after. How bad is that?
It's like sending your medicine into battle without any armor. Coffee changes the acidity in your stomach, so even if you swallow the pill, your body may absorb less of it, or it absorbs it at the wrong time. Either way, your heart's not getting the help it needs.
Okay, what about other meds? Like blood thinners?
Good question. Warfarin, also known as Coumadin, is one of the most common blood thinners, and caffeine messes with it too. It can raise or lower the drug's effect depending on your metabolism. That's dangerous because if warfarin gets too strong, you could bleed. If it gets too weak, you could clot. It's a delicate balance.
So, Doc, should people just give up coffee completely?
Not always. 1 or 2 cups might be okay for some people. But here's the trick: timing. I tell my patients, take your meds first. Wait at least 60 minutes before you drink your coffee. Give your medicine time to work before caffeine enters the picture.
And I guess decaf is safer?
It can be, if it's truly decaf. Some decaf coffees still have small amounts of caffeine. But for most people, switching to decaf or herbal tea is a good move, especially if they're taking medications in the morning.
All right, I've got another one. What about people with anxiety? I've heard caffeine and anxiety don't mix.
You heard right. If you're taking anxiety meds like Xanax or sleep meds like Ambien, caffeine can block those effects. These medications are meant to calm your system down. But if you're drinking coffee at the same time, it's like slamming the gas and brake pedal together. It confuses your brain and body. You'll feel wired, jittery, and unable to sleep, even though the medicine should be helping.
Yikes. That explains a lot. And I bet most people blame the medicine, not the coffee.
Exactly. I've had patients say, "Doc, this pill isn't working." But once we cut back on the caffeine, bam, they start sleeping better, feeling calmer, and the meds finally do their job.
Let me ask about diabetes meds. Is caffeine an issue there, too?
Yes, another big one. Caffeine can mess with blood sugar levels, especially for people with type 2 diabetes. It makes the body less sensitive to insulin, and that means your sugar levels go up after meals. That makes your medication fight harder and sometimes it can't keep up. Not to mention, energy drinks are a double whammy. Tons of caffeine plus sugar. Dangerous combo.
So, Doc, is it fair to say this? Caffeine doesn't directly ruin all meds, but it changes how our body handles them?
That's the perfect way to say it. It's not a poison, but it's a disruptor. It changes the timing, the strength, and the effect of many medications. And when we don't know that, we blame the wrong thing. We think the pill isn't working, or that we need a higher dose. But really, it's the cup of coffee that got in the way.
And this is why we're doing this episode, guys. These are quiet mistakes, little daily habits that slowly throw off your health. You think you're doing fine, until you're not.
Exactly. And remember, this advice isn't just from me. Japan's oldest living doctor, still sharp, still practicing in his 100s, has been shouting this from the rooftops. He says, it's not just what you eat, it's when you eat, and what you eat with your medicine. That timing can make all the difference.
Okay, if you're still with us, that last part from Dr. Adler should have hit hard. Your morning coffee might actually be fighting your meds. But we're not stopping there. Doc, you said earlier, it's not just what we eat, but when we eat and what we pair with our pills. So now I gotta ask, what's the next everyday food that messes with our medicine?
Are you ready for this? Bananas.
Wait, bananas. Come on, document. You mean the friendly yellow fruit? The one I toss in my smoothie, slice on my oatmeal? That banana?
Yes, that banana. Look, bananas are not evil. They're full of good stuff. Fiber, vitamins, and especially potassium. But that's where the problem starts. Potassium is great for your body until it becomes too much, especially if you're taking certain medications.
So what kind of meds are we talking about this time?
Blood pressure meds, ACE inhibitors, and ARBs. These are super common. You've probably heard of names like lisinopril or losartan. They work by helping your blood vessels relax and by lowering your blood pressure. But guess what else they do? They raise your body's potassium levels.
Whoa. So if I'm taking a med that already raises my potassium, and then I eat 2 bananas?
You've just added even more potassium to your system. And when potassium goes too high, it messes with your heart rhythm. In serious cases, it can even stop the heart.
Hold on, like cardiac arrest.
Exactly. It's rare, but it can happen. Most people think potassium is just good no matter what, but your body needs balance. Too little or too much, it can be both dangerous. The real problem is that people don't even realize that their banana smoothie could be pushing their potassium over the edge when combined with meds.
So, how do we fix this? Should people stop eating bananas altogether?
Not necessarily. You just have to watch how many you're eating. 1 banana a day might be fine, but 2, 3 plus fruit juice, plus a high potassium dinner, that's where trouble starts. That's why your doctor might say, hey, cut down on the bananas. If you're on blood pressure meds.
Okay, Doc, this one's gonna make people rethink their fruit bowl. But let's keep going. What's the third food on your list?
Fruit juices.
All right, I give up. First coffee, now bananas, and now fruit juice? What's going on here?
I know it sounds crazy, but fruit juices, especially orange juice, apple juice, and grapefruit juice, can mess with your meds in a totally different way. This isn't about potassium. This is about how your body breaks down medicine.
All right, break it down for us. Document. What's actually happening inside?
Okay, inside your body, you've got something called cytochromes. Think of them as little workers who help break down your meds. They live in your liver and your gut. Well, fruit juices can block those workers.
So, the meds just sit there?
Exactly. Some drugs won't get broken down the right way. Others won't be absorbed at all. For example, orange juice can make it harder for your body to absorb osteoporosis meds like Fosamax. If you drink juice too soon, that pill just doesn't do its job.
So, I could be taking my meds right, but the juice makes it seem like I never took them?
That's the scary part. Yes, apple juice can block blood pressure meds like Tecturna. It also reduces how well meds like Allegra for allergies and Singulair for asthma work. Even atenolol, a common beta blocker, can get blocked if you drink juice right after taking it.
Man, and I thought juice was the healthy choice.
It can be, but not if it gets in the way of your medicine. And get this, grapefruit juice is the worst offender. It messes with cholesterol meds like Lipitor and Zocor. It can raise the drug levels too high and lead to serious side effects.
All right, I need a moment. First, bananas are sneaky. Now, fruit juice is blocking meds. What are we supposed to do, Doc? Just drink water.
Honestly, yes. When it comes to taking meds, water is the best choice. No sugar, no acids, no interference. If you really want juice, wait at least 2 hours after your medicine. That gives your body time to absorb the pill properly.
So timing is everything again.
Exactly. Like Japan's oldest doctor says, it's not just what you eat, it's when you eat. He's been warning about these food medication mistakes for decades. And now that we know how fruit juice blocks enzymes and bananas mess with potassium levels, we can start to be more careful.
Doc, I gotta say, this is eye-opening. I bet a lot of folks listening are gonna head straight to their kitchen and rethink their whole routine.
That's the goal. Not to scare people, but to educate. These are quiet blockers, things you'd never expect. And if just one person hears this and avoids a mistake, it's worth it.
All right, folks, we've gone from coffee to bananas to juice. And Dr. Adler just dropped a powerful line. The right food at the wrong time can turn into the wrong food. That hit me hard. But Doc, you said there are still more foods people eat all the time that can mess with their meds. What's next?
You're not going to believe this one either. It's cheese.
Cheese. Now that's personal. Don't tell me my grilled cheese sandwich is dangerous, too?
It depends. Not all cheeses are risky, but certain types, especially aged ones, can cause a very serious reaction if you're taking medications for depression or Parkinson's disease.
Wait, what kind of reaction are we talking about?
It's called the cheese effect. Sounds funny, but it's not. It's actually a medical emergency. Some depression and Parkinson's medications, called MAOIs, make it hard for your body to handle a chemical called tyramine. And guess what food is loaded with tyramine?
Cheese.
Exactly, especially aged cheeses. Tyramine can raise your blood pressure fast. If someone on an MAOI eats aged cheese, they could have a sudden, severe spike in blood pressure. We're talking headaches, nosebleeds, maybe even a stroke.
Okay, that is not something they teach you on the cheese aisle. So how do you know if your cheese is aged?
Aged cheeses are usually firmer, stronger in flavor, and they've been stored for weeks or even months. Think cheddar, Parmesan, Gouda. They look fancy, and they are, but they're also risky for people on MAOIs. The longer a cheese sits, the more tyramine it builds up.
So, does that mean all dairy is off limits?
Not at all. Fresh cheeses like mozzarella or cottage cheese are usually okay. Even milk and yogurt are fine. The danger comes with cheeses that are aged, fermented, or ripened. That process changes what's inside the cheese. That's where tyramine hides.
Got it. So, if you're on an MAOI, you really need to read your cheese label, or better yet, ask your doctor.
So shte, exactly. And that's not just me saying it. Japan's oldest doctor, still treating patients in his hundreds, has been warning about the cheese reaction for decades. He always says, the food itself isn't the enemy, it's the mismatch between food and medicine that causes the trouble.
That line again, the mismatch. That's powerful. All right, Doc, I hate to ask, but what's the last food on your list today?
Licorice.
Licorice. Now we've gone from grilled cheese to candy? What's the deal with that?
It might seem innocent, but licorice, especially black licorice, is a real troublemaker. It's not just candy, it's also used in herbal teas, supplements, and even some old-school remedies. But here's the twist. It messes with your body's ability to handle certain medications.
Like what kinds?
Blood thinners like warfarin, immune-suppressing drugs like cyclosporin, and steroids like cortisone. Licorice can either make these meds too strong or too weak, and that can lead to major side effects.
So, I guess the problem is it unpredictable?
Exactly. Licorice can confuse the enzymes in your body. These enzymes help break down medication. When licorice steps in, the balance changes. Some medications stick around too long and get too powerful. Others don't last long enough to do their job. It all depends on your body and how much licorice you eat.
Man, and I used to think licorice was just for Halloween.
That's another good point. Most licorice-flavored candies in the US don't even use real licorice anymore. They use anise oil, which just tastes like licorice. So if your favorite candy says licorice, check the label. If it doesn't contain licorice root or extract, it might be safe.
But if it does have the real thing?
Then you need to be careful. especially if you're on meds that control your blood, your immune system, or your hormones. Licorice can also raise your sodium and lower your potassium. That creates a kind of storm inside your body, one that affects blood pressure, fluid balance, and even your heartbeat.
Wow. So, it's like a chain reaction.
Exactly. And the worst part is, people don't even think of it as a risk. It's a snack, right? A treat. But when you're on medication, even the smallest things can have big effects.
All right, Doc, I have to ask, should people stop eating cheese and licorice completely?
No, not unless their doctor says so. It all depends on the medicine they're taking. The biggest mistake is guessing. People assume food is always safe because it's natural or common. But that's not how the body works. It's all about interaction, the way foods and drugs mix inside your system.
That word again, interaction. It's like a dance. And if one partner is off, the whole thing falls apart.
Exactly. And that's why education is key. Japan's oldest doctor always tells his patients, before you put something in your body, ask what it will do once it's inside. That kind of thinking can save lives.
Doc, you've given us so much to think about. From cheese to licorice, from heart meds to herbal teas. Every little bite matters more than we think.
It does. And the best way to stay safe? Talk to your doctor, talk to your pharmacist. Keep asking questions because your medicine can only help you if you let it.
All right, friends, if this episode opened your eyes, be sure to hit that like button, subscribe for more, and share it with someone who loves cheese and candy as much as you do. And here's our question of the day. Have you ever eaten something and felt weird after taking medicine? Tell us your story in the comments. We're all here to learn.